My name is Amanda Tozer. I'm a consultant gynaecologist subspecialising in reproductive medicine, and I'm going to teach you today how to do your drugs for IVF treatment. Now, when you first get your pack of drugs, it might be a little bit overwhelming. You might get a whole array of different drugs in front of you thinking, oh my goodness, what am I supposed to do with all of these? But don't worry, of course somebody's going to teach you, they're going to go through it with you, and the aim of this video is, should you forget, you can always refer back to this video to remind yourself on how to give those drugs. I'm now going to teach you how to use Centrotide. Centrotide comes in boxes like this, and you're often given 4 or 5 of these boxes. Now, inside this box there is a pre-filled syringe, there is a powder, and there are 2 needles. One large needle for drawing up the fluid, for injecting the fluid, and one small needle for injection. Open up your pack and take out the contents. So, as I said, you have a preloaded syringe with fluid. You have 1 vial containing a powder, which is the active ingredient. You have 2 needles. Now, the yellow needle is the larger needle, and you will be injecting the fluid with this needle. The smaller needle, the grey needle, is what you'll be injecting yourself with. Take the blue cap off your powder and take the white cap off the syringe. Take your yellow needle and twist onto the top. And take the top off. Then you will inject the fluid into the capsule. Hold on to it and push it down. You're going to inject the entire contents of the syringe into the fluid. You'll see that it dissolves extremely quickly. You give it a small shake, and then what you need to do is pull that fluid back up into the syringe. The end of the needle is beveled, make sure it's in the fluid, and draw it up. This may take some practice, so if you're unsure, just inject it back in. Perfectly safe to do, pull it back out again until you've got all the fluid in. And you can take your needle out. You're then going to exchange the yellow needle for the smaller grey needle by pushing it on, twist, take it off. Okay. This is much smaller, and this is the needle you'll inject with. And this can be injected either into the abdomen or into the thigh, whichever you prefer. Once you've injected this fluid in, then take your sharps bin that you're provided with and dispose of all your sharps.